Please join me in welcoming the United States Senator from the Commonwealth of Massachusetts, our good friend, Senator Ed Markey.
Thank you, Jimmy. Thank you, Jimmy, so much, and thank you for that introduction and for hosting this very important conference this morning. There is no more important issue which is facing our state, our region, or our country. Jimmy has always symbolized all that was good about public service. More than anything, he was known to take on the tough challenges, and he was always there in order to ensure that he could be a voice for those people who were voiceless. And today's conference really now is part of that legacy which he has. This is the issue of our time. We are in the throes of an epidemic here in Massachusetts and across the country, and your efforts in order to organize and mobilize so that we can fight back against prescription drug and heroin abuse is deeply and sincerely appreciated. We are so grateful for the work that you do and the New England Council is doing. This is an amazing conference. You are doing God's work by beginning this process of involving yourselves in this effort. We have to work together. We have to work in a timely fashion. We have to deal with this rapidly before it just completely slips out of control. It's my honor to be speaking today along with Maggie Hassan and Charlie Baker. They each have put themselves in the forefront of this effort nationally, and we should be the leaders here in New England. We are on almost every issue nationally. We have to show here that this problem can be dealt with. The governor in New Hampshire, she's going to be speaking in about 25 more minutes, and it's just an amazing leadership that she has been giving to our country and to our region, and we thank her for the incredible leadership which she has been providing. Up there in New Hampshire, 25% of the residents up there say that drug abuse is the most important issue, and that jobs in the economy polled at 21%. That's all you have to know. That's all you have to know. We're in the midst of a presidential race. New Hampshire is at the core of who will be the next president, and the residents up there themselves are saying that it is the most important issue. So not taxes, not education, no. And if we did the same poll in almost every state in the union, you would get the exact same result. And without question, and I think every person in this room can say this in a way that they could not say 20 years ago, they all know, and we all know now, someone who is being treated for prescription drug overdose or for heroin. Let me ask this, how many people here know someone who's now being treated for one or the other of those problems? The hands would not have gone up just 20 years ago. Would have been a small, small percentage. So it's now a huge part of each and every one of our lives. And this emergency is in our own hands. I have served in the United States Congress for, hold your own breath, 39 years. And I have never seen an issue like this. I've never seen anything go from 0 to 100 miles an hour this fast at any time. It is a public health emergency. We have thousands of people now coming to Washington and coming to the capital cities of just about every state in the union, and each and every one of those massive groups is saying the exact same thing. Enough is enough. We need a plan in order to deal with this issue. The first powerful moment that I had was on Martin Luther King Day in January of 2014. just about 2 years ago. And I was going to speak in Taunton to their Martin Luther King Day celebration. And while I was standing in the back of the hall waiting for it to begin, I just turned to the mayor, Mayor Hoy of Taunton, and to the police chief. And I said, so what's the biggest issue right now? And the chief and the mayor just looked at me and just said, well, heroin overdoses. You know, we've lost like 7 people in the last month. And so I said, well, just keep talking to me. And so they did, and I said, I'll be back, and I'll be back soon. So 6 weeks later, I brought back the drug czar for the United States, Gil Kurlikowski. And I brought back leaders from all over Massachusetts and all over the country to have a forum right in Taunton, right in the fire station. So we laid it all out. All these national leaders are there, state leaders. And while we were in the fire station, the alarm went off, and the voice over the intercom said, overdose, Main Street. And the alarms went off, and the engines left the station. And so, for me, that was kind of the moment. And, and it was clear that there in Taunton, that this heroin was now being laced with fentanyl, and the fentanyl is the reason for many of these people to actually get addicted, because what they do is they stick this fentanyl inside the heroin that telescopes the time frame that it takes for the individual to become addicted. They own you. They own you in a very brief period of time, just a matter of weeks. It's over. And so all of this is part of a very simple pattern, and I have the mayor of Taunton talking to me about fentanyl. I have a police chief in Taunton talking to me about fentanyl. And the New York Times, the Boston Globe did a story the next day, front page, where they said, and the allegation is that fentanyl is being laced into the heroin. Huh? And so this whole storyline is one that reflects the sophistication of the efforts now made to turn this country, this region, this state, into this incredible marketplace, both for prescription drugs and for heroin. In 1898, a German chemist introduced heroin to the world, a reproduction of an earlier form of morphine, believed to be non-addictive. The name heroin was derived from the German word heroisch, which means heroic. That is how men described the way they felt after taking the new drug. In the first decade of the 20th century, doctors were led to believe that heroin was non-addictive and prescribed it for many ailments. But heroin addiction soon became prevalent. So the government began to regulate its use, including arresting doctors who prescribed it to addicts, and the medical community began to stop prescribing it. Inevitably, those already addicted turned to illegal markets to feed their addiction. Interestingly, even as far back as 1928, John D. Rockefeller Jr. used a portion of his family's fortune to establish the Committee on the Problems of Drug Dependence. The goal of the committee was to find the first non-addictive painkiller through extensive research. Wariness towards prescribing opiate-based painkillers for anything other than terminal illnesses continued through the 20th century, all the way up until the late 1970s and the early 1980s. At that time, an international debate broke out on pain management. The question was asked, was it inhumane to allow patients to suffer needlessly through pain when opiate-based medications were available? Many advocates for increased use of painkillers pointed to a 1980 letter to the New England Journal of Medicine that concluded that only 1% of patients who were prescribed opiate-based painkillers became addicted to their medication. Known as the Porter and Jick letter because it was named after the two Boston researchers who conducted the research and authored the letter, it fueled a belief that opiate-based prescription drugs were not addictive. It was a belief that began to permeate the medical community. But there was a problem with Porter and Jick's conclusions. They had only collected data on patients who were receiving inpatient care. As you can imagine, the percentage of patients who became addicted to opiates while in the hospital was only a tiny fraction of patients who received opiate prescription drugs in an outpatient setting. The medical community was not the only group espousing theories that opiates were not addictive. In 1996, Purdue Pharma brought OxyContin to the market, earning the company $48 million in sales just that first year, 1996. Purdue Pharma claimed Oxy was non-addictive and couldn't be abused. Neither of these claims turned out to be true. Purdue Pharma built a massive marketing and sales program for Oxy. From 1996 to 2000, Purdue Pharma's sales force more than doubled from 318 to 671 sales representatives. In 2001 alone, Purdue gave out $40 million in bonuses to its burgeoning sales force. These sales representatives then targeted prescribers who were more than willing to prescribe opioid painkillers. As a result of these sales and marketing effort, from 1997 to 2002, OxyContin prescriptions increased almost tenfold, from 670,000 prescriptions in 1997 to 6.2 million in 2002. In 2007, Purdue Pharma paid $600 million in fines and other payments after pleading guilty in federal court to misleading regulators, doctors, and patients about the risk of addiction to Oxy and its potential for abuse. The company's president, top lawyer, and former chief medical officer also pled guilty to criminal misdemeanor charges and paid $34 million in fines. By this point, Oxy abuse was rampant. When those who were addicted to Oxys could no longer afford $60 for a 60-milligram pill, they opted for low-priced heroin. Taking advantage of the new demand for heroin was incredibly sophisticated, and it was a network principally of drug traffickers from Mexico, which set up franchises in the United States. They are now responsible for nearly half of this nation's heroin supply and are branching out from large urban areas to our suburbs. These systems collided in a perfect storm that has caused the epidemic we are experiencing today, the overprescription of opioid painkillers by the medical community, the over-the-top sales and marketing program by a deceptive and deep-pocketed pharmaceutical giant, and the overabundance of heroin flowing into the United States from Mexico and South America. According to the Drug Enforcement Administration, in 2013, almost 47,000 Americans died from a drug overdose. That surpassed the roughly 35,000 people killed in automobile accidents and the almost 34,000 people killed in firearms last year. In 2014, more than 1,000 of our friends, neighbors, colleagues, family members in Massachusetts died from overdoses due to prescription drugs or heroin. And Massachusetts is 2% of America's population.